You're listening to Saturday with Ted on NEWSTALK 1010.
Welcome back to the program. Tried talking to your doctor lately in person? You're the lucky one. You're one of the lucky ones if you're seeing your doctor in person, because most are not seeing patients in person, which is why we've invited Dr. Rick Tytus, who is Associate Clinical Professor in the Department of Family Medicine at McMaster University and co-founder of Banty, to join us. Well, what is Banty? Well, let's ask him. Dr. Tytus, good afternoon. What is Banty?
Hey, Ted, it's an honor to be on your show. Banty is the future. The future is right here, right now. Do you remember the old George Jetson?
Yes, of course.
And George Jetson, we're telling our age, but George Jetson, would be able to talk to the doctor using a video platform. They'd never have to leave their house. Well, you can do this now, and that's what Banty is all about. It's a video platform where you can contact your doctor virtually.
Well, is that any different than Zoom?
Yeah, so Zoom is awesome. So is Facebook, so is Hangout. They're all good, but there's a bit of complexities to get on. We have to make it really simple for our patients. So with Banty, there's nothing to download. All you have to do is press the link. Press the link, and there you are. You're right there. But also important is that it's totally encrypted from end to end. So you don't have to worry about that. So you'll be on the call and all of a sudden someone will bomb in on you. So it's totally secure and easy to get on. And that's what we have to do, right? So make it as easy as possible for our patients.
Now, what's the importance of this? Is it because it instills a feeling of confidence in the patient, or does it give a doctor an actual opportunity to examine the patient?
Well, it's studies have shown that if you can see the patient. So right now, before the pandemic, 6% of doctors were using a video platform or virtual medicine. Post-pandemic or after the pandemic hit, so your doc went from face-to-face physical visits to 60 to 80% now are using a virtual medicine. Most of them are using a phone. But if you really want to get a good sense of what's happening with your patient, you have to see the patient. And that's why we're really encouraging doctors and patients to use a video platform.
And how long has this been around?
Our particular platform's been around for the last about 4 to 6 months. We sort of responded to the need that was out there. So, in the past, you could go and see your doc, sit in the waiting room, but now patients are saying, no, I don't want to go in the waiting room. I'm just concerned that, I go to the waiting room, I sit there for a half an hour, I'll be sicker when I leave. So I want the video platform. I want the convenience. I want the security.
So the patient has to download Banty as well as the doctor?
Yeah. So the beauty is that there's nothing to download. So what happens is you are given the link, and the patient says, okay, your appointment's tomorrow at 10 o'clock. So we send you an email, and then all you have to do is press the link. Nothing to download, and that's the beauty of it.
Yeah, that is terrific.
So we want to make it as easy as possible, improve patient access, so you can see your own doctor easily.
What's been the reaction from the medical community?
The medical community loves it because, again, like here we are in COVID, we're concerned for our patients, and we want our patients to access us for their care. So the doctors love it, and the patients love it. And Ted, to be honest with you, I think this is the way of the future. I think that seeing your doctor virtually, even after the pandemic, patients like it so much, they're going to continue to do so.
Yeah, I think you're right. I mean, I think in most cases you don't need to actually see your doctor. to be there physically, but in some cases, if you've developed some sort of skin disease or skin rash or something, or you think you may have broken something, then maybe in that case you would need to see them.
Yeah, for sure. I think there's always going to be a physical footprint, but I think most of the time you can see things virtually. And it's like, taking your dad or granddad to the doctors. You have to get them into the car or drive them to the doctor's office. And by the time the doctor takes the blood pressure is crazy because, the only thing that your granddad wants to do at that time is go home. Whereas if I can see him virtually at home, sitting in his own chair, you do the blood pressure, someone does the blood pressure right then and there, that's really more reflective of reality. So I think at the end of the day, you get better care using virtual medicine for a lot of conditions.
Is there any way that you can eventually take people's blood pressure with Banty?
No, but what you can do with a lot of patients have their own blood pressure units. So I'm a big fan of taking your blood pressure at home, getting rid of the first reading, and then recording the second. And then when I call you, I want to know what that blood pressure is. Or even in the past, when you come in to see me, I'd ask, did you bring your blood pressure, journal? Because that blood pressure journal is so much more valuable than that just one blood pressure you take in the office.
Yeah, but is that, what is that, the white coat syndrome? Is that what it's called?
Yeah, white coat syndrome, or, you have to drive across town, you have to find a parking spot, you have to sit in the waiting room, kids are screaming, and, by the time you get into the doctor's office, really...
Yeah. Dr. Rick Tytus is my guest. He's Associate Clinical Professor in the Department of Family Medicine at McMaster University and co-founder of Banty, which is what we've been chatting about. Is this an expensive proposition for your physician?
No, it's inexpensive. I think it's like $29 a month. And what happens is, instead of seeing someone in their physical examining room, now the doc sees them in the virtual exam room. So when you come to the doctor's office, you're going to come to the virtual waiting room, and then when the doctor's ready to see you, he takes you from the virtual waiting room to the virtual exam room, and then he locks the door, and it's secure. And then you have that same interaction that you would have if you had to come face to face. But it improves accessibility. You don't have to drive. You don't have to wait. And also protects the doctor and you.
It's a great idea. And I appreciate you spending some time to explain it to us, Doctor.
Well, you're welcome to come and join me sometime.
Virtually or in reality?
Oh, virtually. Just virtually. It's like George Jetson. The future's here now.
Okay. Does that make me Leroy? Or Elrod or whatever? Elroy, that was his name.
Elroy. It's Elroy, yes.
There you go. Dr. Rick Tytus, Associate Clinical Professor in the Department of Family Medicine at McMaster University and co-founder of Banty. Thanks for your time. Have a great weekend and Merry Christmas to you.
Okay, thank you. And be positive, test negative.